And that leads us to this question of combination therapy in the study that was published by Kieran Marr earlier this year. And this question has really never been answered for us. And even now, I'm afraid we don't have a full answer. Patients were randomly allocated to a combination of voriconazole and an echinocandin, and voriconazole versus placebo. The major outcome of interest was all-cause mortality at 6 weeks, and that endpoint was not met. Certainly there's a trend, but that endpoint was not met. Similarly, the all-cause mortality at 12 weeks, again, a trend in that direction, but was not met. However, in the subpopulation of patients for whom the diagnosis of probable invasive fungal infection, in this case aspergillosis, was based upon galactomannan, there was a treatment effect in this post hoc analysis, as shown here. So that raised a question of another observation in post hoc analysis that's of interest to us, is this question of the Goldilocks effect. That is, not all patients will respond depending upon the burden of the disease. And we're using the galactomannan in this particular example as a surrogate marker of burden of disease. For patients whose high burden of disease, based upon a higher serum galactomannan, the mortality rates were extremely high. And among those patients for whom the burden of disease was low, as measured by a lower galactomannan and using some other criteria like microbiological isolates from the lower respiratory tract, the burden of disease was low and the mortality rates were also quite low, and no difference between the combination versus the monotherapy arm. But in the middle, where the burden of disease was considered moderate, there was a detectable treatment effect. Now, how I use this information at the bedside, I'm not yet sure. But it does tell us that knowing something of the burden of disease has a lot to do with the prognosis I can deliver to the patient.